My name is Lauren Ivanoski, and I'm going to be a doctor. Payton Locke will be our patient, and then Heather Adams is recording the video. We're going to start with testing cranial nerve 1. All right, I'll have you close your eyes for me. And then, what do you smell?
Mint.
Mint. Perfect. All right, so now I'm going to do cranial nerve 2 testing. I'm going to start with confrontational visual fields. I'll hand you this. Cover up your left eye for me. I want you to look at my open eye. Tell me how many fingers I'm holding up.
2.
Awesome.
1.
Yep.
1.
Good. 2. Good. Cover up your other eye for me. And look at this open eye.
2.
Good. 1. Perfect. 1. Good. 1. Perfect. I'll have you cover up your left eye again for me. I'm going to now test the Snellen chart with her. What is the smallest line that you can read here?
LRHZPF.
Perfect. And cover up your other eye. How about now?
AOZDRP.
Okay. Alright, so now I will be testing cranial nerve 3, 4, and 6. And so I'm going to start by doing the physiological H, testing all of our EOMs. Alright, I want you to stare at this light here. I'm going to move it. Just follow it with your eyes, not your head. Let me know if you experience any pain or double vision, okay?
Okay.
Did you experience any pain or double vision? Perfect. Alright. So now I'm going to test accommodation. Alright, I'll have you look at the big V out there, and I'm going to hold my finger up here. When I say switch, switch to my finger, okay? And switch, 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 switch. Her pupils are constricting at near and dilating at far, and they accommodate. And now I'm going to test her pupil size to make sure that they constrict with light. I'll have you stare at that big B here, and it's going to get kind of bright, okay? So I'm testing direct right now, and her pupil is constricting. And now consensual. Both pupils are constricting. So I can say Perla. Alright, so now I'm going to test cranial nerve 5. I'm going to have you bite down for me. I'm just going to feel her masseter and her temporal. Good. And now I'm going to have you resist. Good. Perfect. Alright, now I'm going to test cranial nerve 7. I'll have you close your eyes super tight for me. Perfect. Now smile, frown, puff out your cheeks. Good. Do that all with ease?
Yeah.
Perfect. And now I'm going to test cranial nerve 8. I'll have you plug one ear for me. You're going to come over and whisper in her ear. Did you hear me?
Mm-hmm.
Perfect. I'll have you cover your other ear. Good? Perfect. Alright, so now what I'm going to do is I'm going to test cranial nerve 9 and 10. I'll have you open your mouth and say ah for me.
Ah.
Good. I'm looking at the uvula and it went up for cranial nerve 9. And for cranial nerve 10, can you swallow?
Mm-hmm.
Any hoarseness or difficulty?
No.
Perfect. Alright, now I'm going to be testing cranial nerve 11. Alright, I'll have you move your head from side to side and up and down for me. Perfect. And now I'm gonna put my hands here. Shrug your shoulders for me. Perfect. Now I'm gonna test cranial nerve 12. I'll have you stick your tongue out and move it side to side. Awesome.